When recovering from an injury or medical condition, there's no better place to do so than the comfort of your own home. Here to tell us more about what Home Rehab Express can do for you or do for a loved one is Marcos Porras. He is the owner of Home Rehab Express, and also Dr. Mark Farmer. He is with Orthopedic Center of Florida. I'm still working on rolling my R's. I'll just go ahead and say it.
That's okay.
Home Rehab Express, as I said, there really is no better place than being in the comfort of your own home. Explain to everybody how you can really help out a loved one or help them if they are going through a situation where they would need you guys.
Yes, post-surgical, basically, we are an ancillary service that goes out to your home and provides skilled nursing, physical therapist, occupational therapist, even a home health aide if needed, to help in the recovery of a replacement of a knee or a hip.
And a lot of times if you are talking about knee pain, Dr. Farmer, how would you differentiate that from maybe arthritis?
A lot of the time, the most important thing is to get an x-ray. We talk to the patients, we get a history from them, find out, is this a long-standing problem? Is this something that just happened with a new injury? And then after we've asked them several questions, things that make it worse, things that make it better, we then get an x-ray, and then we take a look at the x-ray. And that, a lot of the time, is going to determine what we do and how we treat them. Because there are certain findings we look for on x-rays that will show us that this is either an arthritic problem or something like a meniscus or a cartilage problem inside the knee.
Okay, so when you do look at the x-ray, what exactly are you looking for?
We're looking for the joint space. So you have a femur bone, at least in the knee, obviously you have a femur bone and a tibia bone, and if those bones are rubbing together, in a normal knee, you have a nice space there, about anywhere between sort of 8 millimeters and a centimeter between the two, and it's even on both the inside and the outside, and then everything looks nice and smooth. In an arthritic knee, what we have is the bone gets closer to each other, so it can even rub. It can cause bone spurs. It can cause cysts in the bone. And it can cause what we call sclerosis, which is an increase in density on the x-ray that we look for. And then that can determine where we move from there.
Okay. Are there a lot of available treatments? I know certainly this is really a good place where Home Rehab Express would come in when you are looking for at-home treatments. But what are the options when it does come to those treatments?
Well, initially when we treat arthritis, we try to treat it without surgery. Surgery to us is a last resort, and so there are certain things that we can do. Most of the patients who see us have already tried some anti-inflammatory medications like an Advil or an ibuprofen or an Aleve, and most of those, by the time they see us, usually are not working very well. So then we're left with a couple of other alternatives. So usually the first step would be an injection of cortisone, which is an anti-inflammatory medicine that we put in a fairly high dose into the joints, and that works a lot of the time for a lot of people. It's variable in terms of how long it works. If that doesn't work, or it only lasts for a couple of weeks or even a few days, then we can try a different type of injection. There's some stuff that we call viscosupplementation. There are various name brands for it. People call it chicken juice or gel injections into the knees. And that's usually a series of 3 injections over 3 weeks. I tell patients that typically works about 70% of the time. On average, it will give people about 6 to 9 months of relief, depending on the severity of their arthritis. I've seen it last up to 4 or 5 years occasionally, too.
Okay. So once we're ready to pack things up and head home after that treatment, what kind of treatments can you offer us, Marcos, with Home Rehab Express?
Well, like I said, the initial assessment is done by the nurse, and then the physical therapist follows suit pretty much the same day or the very within 24 hours. And it's an A to Z assessment as to how they're moving around the house. Can they get to the commode? Can they get to a different sitting area? And make sure that they've given an exercise program so that they have a focus as to how, what, where, and when to do what the task involves.
It's got to be nice to have a helping hand, especially if you don't, have any family around, or depending on what your situation is. If you're dealing with your knees and you're having trouble walking, certainly that service is going to be.
And sometimes we've got to move some furniture around just for gain access, because they didn't think that they were going to need a walker around the house.
If people want to learn more about your services, is the website the best place for them to kind of go and learn more? And that's going to be homerehabexpress.com. Also, if you want more information on Home Rehab Express, you can always go to our website, and that's going to be fox4morningblend.com.